Good morning. My name is Dr. Brennan and we're going to be having Precision Movement and Pain Clinic opening in CrossFit Amis on June 1st. And conveniently enough, and rightfully so, Mr. Mike's going to be the first patient. So today you're going to follow us in and watch a little bit of our treatment session. Yeah, just walk all the way back to the room. So we'll be walking back to the back of the hallway, and we'll be in the back left room. And don't worry, this will definitely look different. All right, Mike. So got the brace on. I was asking you how the foot's feeling. Tell me a little bit about what's going on, how long it's been bothering you, that type of things.
So it actually probably started a couple of months ago. I was doing some shuttles. We had to work out with a lot of shuttle runs. And I was fine that day. The next day, I started experiencing pain in the heel, in the base of the heel, and really just kind of figured it would just go away after a while, and it was just persistent. So, and then probably within the last couple of weeks, it is now, turned into a foot drop.
Okay.
So I have no strength in the dorsiflexion.
Gotcha.
In my right foot.
Okay. And then how's it feel with like walking and stairs and any daily things?
So, I mean, typically there is, because of the plantars, I have some pain in the heel when I walk. This brace that I got yesterday seems to help.
Okay.
I don't profess to know exactly how it works, but I think it positions the foot where it helps to take some of the strain off of the plantar tissue. So
Gotcha.
Yeah.
All right. Well, we'll get into a few tests, and then after that, we'll get started with some treatments.
Okay, great.
Thank you. Pause it there. The computer a little bit. Perfect. All right. Go ahead, Mike. Good. Okay. Camera. All right, so first thing we're looking at is your feet. Feet are both facing pretty straight, so I like to see that. I was expecting one of them to be turned in or turned out, so we like that. Next, we'll kind of look how you're stabilizing through your hips when you're standing. So left leg, your right hip's dropping pretty significantly, so we already see a little bit of weakness on that left hip that we're going to pay attention to. And that right side, we have a lot of tightness on that right side, so we stay standing on the right side quite a bit, favoring that, putting a lot of weight on that right leg right now.
Okay.
And it is the right foot, correct? So even with the right leg being painful, you're still putting a lot of weight on your right leg. So you would think that right now you'd be shifting towards your left, but even with the pain, you're staying over to the right. So it shows me that you're having a hard time loading your left leg. A lot of weakness on that left leg, a lot of tightness on the right leg.
Okay.
So let's get into some treatments.
Yeah, there's probably some history behind that. So when I had my hips replaced, the first one that was replaced was the left one.
Okay.
It was the most affected. So I think the problem is, for years, I've always favored, the left leg was weaker and I was relying on the right. So just over years of doing that, I haven't recovered from that. I think that's because I've actually had both hips replaced.
See, without even knowing all of that, just by seeing a couple walks and movements, can pick up on a lot of that. So That's what I love about the technology. It helps out quite a bit.
Yeah.
Let's go face down and we'll get started. All right. So this is a great example, Mike, of misdiagnosis. So that plantar fasciitis, your pain would be more along the inside and more on this part of the heel. Yours is all along the inside and then going into the inside of the calf, which is the muscle that actually controls your big toe, called your flexor hallicus, and is one of the primary stabilizers of the ankle. And so rehab for the plantar fascia is not going to do much good. We got to rehab this area. So after this today, I'll send you some videos for you to do on your own. Yeah. So when you stand up after the treatment, the sharpness of the pain should be much more reduced, but there might be a little bit of soreness from what I just did. All right, we'll work on this right hip. We can end up the 32. All right, as long as it's not right about 32. Yeah, give me the video. Some of it will be audio, some of it will just be video. Okay. Sit up, turn it back. And then you can come over here for a second. There we go. Yeah, I'll do it for that ankle. Right there. Okay. Good. Stand up. Walk on that a bit. How's that feel?
Well, I don't feel as much pain in the heel as I did before.
And we didn't even touch the heel. Stand up. Already making some progress. We'll keep it going forward.
All right.
First good session.
All right.